Hey there, welcome back to Midnight Med. This video is on preconception counselling and infertility. Preconception counselling is an important part of antenatal care because it aims to optimize a woman's health prior to pregnancy in order to improve her fertility as well as her health outcomes and those of her future children. I will go through the key components of preconception counselling and some further investigations that may be undertaken in the event that a couple has difficulty conceiving. The first important step in preconception counselling is to establish the couple's intention to fall pregnant. If they do not wish to fall pregnant imminently, then advice around family planning and contraception options should be provided. Beyond this, it is important to review the woman's medical history and ensure that any chronic conditions she suffers from are managed appropriately. Some key conditions include diabetes, cardiac and renal disease, depression and anxiety, and seizure disorders, and there is an increased risk of complications and progression during pregnancy with these. Importantly, the treating clinician needs to review the woman's regular medications and switch potentially teratogenic medications to those that are safe in pregnancy. Screening for genetic conditions is another important part of preconception counseling, so a family can be appropriately educated on the risks of their future children carrying genetic conditions. Family history and ethnicity are informative in this context. As noted in the video on immunization in pregnancy, it's important to screen for infectious disease and immunization and vaccination status. The key vaccines and diseases to be cognizant of are hepatitis B, DTPA, so that's diphtheria, tetanus, and pertussis, and MMR, which is measles, mumps, and rubella. I recommend reviewing the immunization video as we go through some of the key complications that can arise from these infections and why it's important that pregnant women are immunized against them. Lifestyle factor modification is a significant part of preconception counseling too. Managing weight is a primary step that is essential in ensuring optimal outcomes for both mother and child. Moderate exercise and nutritional management are recommended. Obesity confers an elevated risk of stillbirth and pregnancy complications and can increase the risk of the child developing metabolic disease later in life. I recommend reviewing the video on gestational diabetes in order to brush up on some of these risks. Underweight mothers confer an increased risk of low birth weight and preterm birth. Importantly, nutrition and weight management are important for oocyte quality as well. Folic acid and iodine supplementation are also essential for the early development of the child in utero. At least 0.4 milligrams of folic acid per day is required for a month prior to conception and for the 3 months subsequent to conception in order to guard against the risk of congenital abnormalities like neural tube defects. This dose of folic acid should be increased to 5 milligrams daily if there is an already increased risk of neural tube defect, such as if there is a family history, diabetes, or obesity. At least 150 micrograms of iodine supplementation should be taken daily around the time of conception as well. A further key lifestyle factor that needs to be addressed in preconception counseling is substance use. Maternal smoking is associated with preterm birth, low birth weight, and negative impacts on fertility in general. Maternal alcohol use is associated with fetal alcohol syndrome, and other substances are associated with abstinence syndromes, low birth weight, hemorrhage, and fetal or infant mortality. Because of these negative impacts, care must be taken to advise prospective mothers to abstain from these substances before and during pregnancy. Environmental exposures like heavy metals and toxins can lead to birth defects, fetal death, and infertility, so it's important that these are appropriately managed. Changing tack a little bit, infertility investigations would be a part of some preconception counseling where a couple is struggling to fall pregnant. The definition of infertility is the failure to fall pregnant despite 12 months of regular, appropriately timed sexual intercourse. Investigation of both the man and woman is required because the cause for the couple's infertility could be from either side. When investigating the male, semen analysis is the main investigation. The normal minimum values would be 1.5 mils of ejaculate, a total sperm count of 39 million, a sperm concentration of 15 million sperm per mil, motility of 40%, and 4% of the sperm having normal morphology. Hormone analysis can be done with LH, FSH, and testosterone to check for primary or secondary gonadal failure. A testicular biopsy can be done in some cases to investigate obstructive causes. In the female, the key investigation is ovulation history and analysis, with the day 21 progesterone being the main blood test used. The normal reference would be between 20 and 25 nanomoles per litre. Note that day 21 is the marker we use if we assume a normal 28-day cycle with a 14-day luteal phase. The timing should be 7 days prior to the onset of a menstrual period and can therefore be adjusted depending on the length of the woman's cycle. Note also that thyroid-stimulating hormone and prolactin might be elevated in irregular ovulation and might provide some clues as to the cause of the infertility. Further investigations that can be done include checking anti-Müllerian hormone or AMH, LH, and FSH as a proxy for ovarian reserve. If testing is normal up to this point, an LH and FSH ratio can be done to investigate PCOS. If there is no apparent hormonal cause, then tubal patency can be investigated using hysterosalpingography. If the causes of the infertility cannot be corrected, then the couple should be referred to infertility treatments like IVF. So that's it. Thank you for watching. Hope you found that helpful. Don't forget to like, subscribe, follow us on Instagram at MidnightMed1200 for more, and we'll see you in the next video.